All right. I guess I'm going to get started. Hi, everyone. I am Dr. Riwa Sabbagh. I am a reproductive endocrinologist at Boston IVF. I see patients in the Concord office in person, but I also do a lot of telehealth. And so I just want to thank you all for joining me today for this little lunchtime Q&A. This live Q&A is going to be focused on unexplained infertility. So I'm just going to start with like a brief 5-minute overview of unexplained infertility, and then we can spend the remaining of the time answering any questions you all may have. All right. So unexplained infertility, it refers to the failure to achieve a pregnancy after trying for 6 to 12 months, depending on your age, despite having normal findings during your fertility workup. And it can affect up to 30% of couples. And it's usually a diagnosis of exclusion, which means we looked for all other causes and nothing really came back positive. Now, your fertility really depends on several factors. It depends a lot on your age, it depends on your ovulation, it depends on the patency of your fallopian tubes, it can depend on having adequate sperm parameters. You also need to be able to achieve fertilization, implantation, so a lot of things come into play. And in unexplained infertility, usually all factors that we test for are normal. So usually we'll have regular, meaning ovulatory cycles. You usually would have age appropriate ovarian reserve, patent fallopian tubes, both tubes being patent, a normal uterine cavity evaluation, normal semen analysis. But there could be some other underlying mechanisms that can play a role, with a big one being age. So there is an age-related decline in our egg quality and so in fertility as well. There could be some endometrial issues that can cause implantation failure. There could be some, sperm functional abnormalities, microscopic endometriosis, among several other factors, but nothing usually comes up abnormal in our comprehensive fertility workup. I know it can be a difficult diagnosis to get, a diagnosis of unexplained infertility, because a lot of us really want to be able to pinpoint what's going on, but it doesn't really mean that we can't treat it. In fact, we can. And so the management, though, is empiric, but it takes a lot of factors into account. And so we take into account your age, your preferences, your desired family size. So in terms of treatment options, just briefly, expected management, so continuing to try to conceive on your own, always remains an option, but usually with a lower chance of success because you've already been trying for a while without any success. So it's usually a less than 5% chance of success per month at this time. A second option is ovarian stimulation with oral medications like letrozole or Clomid, if you're familiar with those, as well as an intrauterine insemination. So these ovarian stimulating agents, they can help increase the number of available oocytes or available eggs. And the IUI or intrauterine insemination can help bypass some sperm transport barriers. And so it can increase a couple's chance of success to around 10% per cycle. And I always tell my patients this. I know it doesn't sound very high, the 10% chance, but remember that it is a less than 5% chance of success without the IUI treatment. And so we really are increasing your chances by doing this. And then last but not least, another option is IVF or in vitro fertilization, which does have a higher success rate, and the rates do depend on age, but they can go all the way up to about 60% chance of success. Now, in terms of what to choose, can be very specific on your case, but we do have some good evidence to suggest that if you are over 38, that going straight to IVF can offer you the highest chance of success and the quickest time to pregnancy. But if you're younger than that, it is reasonable to consider 3 to 4 cycles of ovarian stimulation with IUI first. And so if you are diagnosed with unexplained infertility, really talk to your reproductive endocrinologist, because the goal is to provide you with a tailored and individualized treatment plan that is right for you. All right, that ends my little overview. and we can definitely start with some questions. So I'm just pulling up the questions here. Our first question is, what are the chances of IVF being successful in the first round? So the chances of success really depend on your age, and especially if you have unexplained infertility, age is the biggest driving force as to how successful you will be. And so if you're under 35, it's usually about a 50 to 60% chance of success from the first round. If you're older than 35, it can vary. And so if you're over 42, it's about a less than 5% chance of working, unfortunately. And then in between, it can range between 10 to 40%, depending on your age. So it goes higher the younger you are. How do you naturally boost male fertility? That's a good question. So unfortunately for women who are born with all the eggs they're ever going to have, in men, it's a little bit different. And so sperm is continuously being made. And so a lot of lifestyle factors can affect sperm quality. And so optimizing those factors can help boost male fertility. So for example, avoiding things like smoking, marijuana use, certain environmental toxins, prolonged heat exposure. So avoiding all of these can help. Regular exercise and weight loss can also sometimes help because they can decrease your natural estrogen production in men, and that can help with sperm production. And at Boston IVF, we usually will always recommend that you see a reproductive urologist if you have any abnormal sperm parameters, so that they can help evaluate you and see if you need any sort of treatment. Another question is, what are some adenomyosis treatment options for transfer or before transfer? So for those of you who don't know what adenomyosis is, it's basically endometriosis of the uterine muscle. So it is when the tissue of the lining of the uterus grows in or infiltrates into the muscle, and it can cause enlargement of the uterus, and in some cases can impact your implantation rate. And so it can be difficult to treat. But if it is believed to be the cause of your implantation failure, for example, some treatment options could be the type of embryo transfer protocol that you are doing, for example, focusing on a more medicated approach rather than a natural approach. In some cases, we can also consider a downregulation of your hormones with things like Lupron and Letrozole for a couple months prior to embryo transfer. But again, it's all a case-by-case basis. And of course, if you are diagnosed with adenomyosis, please talk to your reproductive endocrinologist about it. Another question here in the chat is, how important is keeping caffeine low? And is this only during a certain point in the cycle? So for caffeine, usually we would say the recommended dose is to stay under the 300 to 500 milligrams for caffeine intake per day. I say usually 1 to 3 cups, with 3 being the higher end or higher threshold. So 1 to 2 cups on average should be fine. There isn't a specific time where at that point you should decrease it. But of course, if you are pregnant, 1 to 3. If you're in treatment for IVF, I mean, up until the point of actually proceeding with the embryo transfer, the 1 to 2 cups is not as stringent of a recommendation, but always act pregnant when you're going through your IVF treatment cycle or fertility treatment. And so the 1 to 2 cups up to 3 cups would be my recommendation. Sorry, questions are coming in. Okay. What are those underlying mechanisms for unexplained infertility based on examples of patients you have seen at Boston IVF? So when we say unexplained, it means that nothing comes back positive on the testing. Now, it doesn't mean that there isn't a true cause. It's just that based on the normal workup that we have and the technology that we have, we couldn't pinpoint something. But some underlying mechanisms could be, for example, endometriosis. If it's microscopic, not picked up based on your symptoms, like you have no symptoms of endometriosis, meaning you don't have painful periods or anything like that. There isn't any visible endometriosis that was seen on ultrasound. It doesn't mean that you don't have microscopic endometriosis that could impact your fertility. Other things could be sperm related. For example, you could have normal sperm parameters or a normal semen analysis, but still have abnormalities and other things that we don't typically test for from the very beginning, like DNA fragmentation and so on. These can impact your fertility, but a lot of it is age driven, especially in the unexplained category. If you have unexplained infertility and are able to achieve pregnancy via IVF, how does it impact the course of pregnancy through the trimesters compared to a natural conception? Are you at higher risk of certain conditions, for example, preeclampsia? So that's a very good question. So in general, we say an IVF pregnancy is no different than a natural or an unassisted pregnancy when it comes to when you've transferred care to your OBGYN, you're going through your pregnancy. It's a little bit different in the beginning, meaning some of you may be on progesterone, others not. But other than that, the rest of the pregnancy is the same. In terms of risks, nothing really has proven higher risks of things like birth defects and so on. There are some studies that showed slight increased risk of abnormal placentation, but that is fairly low. And with that comes certain placental abnormalities, like things that can put you at higher risk for high blood pressure or preeclampsia. But I would still say fairly low, that you do end up getting screened for this all throughout your pregnancy. Your blood pressure gets checked very regularly at every prenatal visit. So again, the risk is very, very low. I am a carrier of a neurological disorder, MECP2. I will have to undergo IVF when I'm ready to have children. Do you have a wait list? That's a good question. I mean, that would be a question for the rest of our team that's scheduling appointments. I don't believe that we do, but please make an appointment sooner rather than later, because just to put things in perspective, it can take several months to get you ready for IVF, especially if you're testing for a specific gene where you would need something called PGT-M when we're screening you for a specific mutation. And it can take several months to get started. So please reach out, as early as possible if you think you're ready to conceive in the next few months so that you can get everything going. I speak Spanish. Are there translation services available? Yes, there are. So we do have translation services available for every appointment that you have with your provider, as well with our nursing team to accommodate for that. So we understand we definitely want to be able to talk to you with whatever language is more comfortable for you so that you have the best understanding of your treatment. We also, because we have, we have a big team, different providers that are comfortable speaking different languages. So please look into that when you are making your appointment. I just had my baseline ultrasound today to start stimulation. I'm 35. My scan showed 12 follicles on the left ovary and 11 on the right. Is that considered a good number to start with? So the baseline ultrasound and the number of follicles is definitely a common question that we get. So 12 on one side, 11 on the other, a total of 23. That is reflective of a really good ovarian reserve that you have. It's what we look at when we do your antral follicle count, for example, during your baseline testing. So I'm assuming you have good ovarian reserve, which is good for your age as well. Now, in terms of how reflective that is of how many follicles will develop during the IVF cycle, it's hard to say because they don't all respond to they don't all develop, they don't all grow. And you have to think of it's a very subjective measure. So your ultrasonographer, your physician, whoever's doing the ultrasound, is just scanning through your ovary and counting these little follicles where they may miss some, they may not. And so though it is a really good number to start with, I wouldn't really use that as how I'm going to respond, meaning I'm going to get 23 eggs out of these initial 23, if that makes sense, because they don't all grow, and they don't all grow at the same rate. How can coenzyme Q10 improve fertility? So coenzyme Q10 is something you can get over the counter in the vitamin aisles, and there is a thought that can it help with egg quality? I would say for egg quality, the biggest driving force is age. Nothing we can do, no supplement we can take can kind of trump that or bypass that or improve it. But it's a low risk medication. It's available. I usually can recommend it for certain patients, if not everybody. So it's not wrong to take coenzyme Q10 to kind of help a little bit with egg quality and fertility. So can be beneficial. I'm moving to another state and will be leaving my embryo store here. When can I come back for the transfer in the future? How much time should I plan to stay in town for the whole process? So good luck with your move. And in terms of timing, so it'll depend on kind of your testing, also insurance. So if you have insurance that still covers getting the embryo transferred in a certain state, that will all have to be figured out. But timing wise for the treatment, I would say most people, if it's been a while since they've got testing, will need updated testing, meaning updated hormone levels and at least like a saline sonogram to look at the inside of your uterus, make sure that there isn't any polyps or scar tissue and so on, which can take about a month because it is cycle dependent. And then depending on what's going on with insurance, we do have to put a treatment plan in, at least for the state of Massachusetts, where we need insurance approval, which can take several weeks. And then the treatment cycle is about 3 weeks from start to embryo transfer. And then the pregnancy test is about 10 days later. And so I would say 2 to 3 months before you want to actually transfer the embryo would be a good time to kind of check back in, start getting testing done, and get the process going. What are the chances of natural conception after successful IVF transfer and live birth? So we do see it quite frequently that you can have a successful pregnancy after or an unassisted pregnancy after a successful IVF pregnancy. The chances depend really on several things. So I don't have specific numbers, but the chances will depend on what your initial diagnosis is. So if your diagnosis was an ovulation disorder, and after you delivered and your periods are back to normal or they're fine or related to some lifestyle changes, you're back to ovulating, then you should have normal conception rates based on your age at that time. If you had other reasons for the infertility, for example, if it was a male factor issue and then the sperm parameters have improved, then yes, you do have higher chances of a natural conception. But if it was something else that's unrelated, if it was diminished ovarian reserve, endometriosis, something else, then sometimes the chances may not be higher after you've had a live birth. But a prior success is a good indicator of hopefully another successful outcome. It means your body can do it. You've done it before, and hopefully you can do it again. Under what parameters is ICSI recommended for couples with unexplained infertility? So usually if you have unexplained infertility, means your sperm parameters are all normal, at least the ones we're looking for, meaning normal volume, concentration, normal motility of the sperm, and morphology of the sperm. In that case, when we have normal semen parameters and no male factor infertility, ICSI is no better than conventional or regular insemination. So we would not usually recommend ICSI in those cases unless you've had a prior IVF cycle, for example, with poor fertilization, be it egg or sperm related, unclear, and it'll be dependent on your specific situation and cycle. But in those cases, we sometimes do move forward with ICSI if you've had prior poor or failed fertilization. But just with unexplained infertility, normal semen parameters, usually ICSI is no better than conventional or regular insemination. I have PCOS and irregular menstrual cycles. What would treatment look like? So when you have irregular cycles related to PCOS or another ovulation issue, usually the issue is getting you to ovulate. And so once we get you to ovulate, or once you do get to ovulate, sometimes you can be successful that way. So treatment will depend on if there is anything else going on other than just the ovulation issue. But if it's just PCOS related, usually ovulation induction, for example, with letrozole and timed intercourse. So we monitor you in around the time of ovulation and let you know when that happens so you could have timed intercourse, or combined with an IUI usually works well. But it does depend on your age. And so if you're on the younger side, then that could be a great option. But if you're, over 38 or over 35, it's a little bit dependent, and you want, multiple children, then sometimes even if getting you to ovulate will offer you a higher chance of success than not doing anything, sometimes moving straight to IVF can be more beneficial just to be able to get you to your desired family size. Is it possible to implant 2 or more embryos at Boston IVF? Short answer is yes, it is possible. I would say the norm is single embryo transfer. We've kind of shied away from transferring more than one embryo because we have such high success rates. And so in the lab, the success rates are so much higher that we usually transfer only one. But there are certain circumstances where we would transfer more than one. Now, if your embryos are tested, meaning they've undergone PGTA and been tested for chromosomes and they are chromosomally normal, irrespective of your age, we would recommend transferring one embryo at a time because it's such a high success rate. And so we'd be a high chance of twins if you transfer two. Now, if they are untested embryos, meaning we don't know what the chromosomes are, then it kind of depends on your age. If you're under 35, we usually recommend a single embryo transfer. If you're over 35, usually if you're over 37 or 38, there are instances where we would transfer more than one. And if you're in this in between 35 to 38, and if you've had like a prior failed embryo transfer, we sometimes do recommend transferring two to kind of give the chance of at least one of them sticking. But it'll depend on your specific condition. So yes, there are instances where we transfer more than one. I'm getting really stressed as the holiday season approaches. Any advice for handling nosy relatives? I understand the holidays can be a very, very stressful time, especially if you're going through a fertility journey or fertility treatments. I would say it depends how much you want to share. If you're the type that really doesn't want to share your journey, and that is totally okay because it is your journey, and if you don't want to share it, I would, one, try to not mention it. If it does come up, I would just keep it brief. Like, it is definitely something we have talked about, and we're dealing with this in our own way, and we'll share with you whenever we're ready. You can also share a little bit, meaning sometimes it can ease the questions. You can be like, I've had some we've had some trouble. We're getting the help that we need, and we'll keep you posted. That can also let somebody know, like, okay, I know they've thought about it, and I don't need to ask any more questions. And I think around the holidays, try to focus a lot on self-care and use this time to kind of reconnect with your partner. Do things that are helpful for you, like if exercise is helpful, do that. Going on walks, travel, whatever can help ease your stress during this holiday season is really important. Focus on your self-care. I have my consultation with Boston IVF in 2 weeks. What can I expect? Well, that's wonderful. We're so happy that you're coming to see us. What I would expect, so your first appointment with your provider is kind of all about you, is trying to get to know you. So, you'll be talking to us about your journey and getting here, what you've been trying to do to help, conceive over the past several months or year, or whatever your journey looked like so far. Usually we'd go through your history in a lot of detail, your history as well as your partner's history. We talk about what expectations you have, and then we talk about testing. If you've had prior testing done before with your primary care provider, your OBGYN, and you've sent that, we would have reviewed it before, and we would talk about those results with you. Or if not, that's totally fine. We would, go through all the testing that we need, lay out a plan, and briefly go over some treatment options that's right for you. And then we would schedule a follow-up appointment to go through that. But your first appointment is just us getting to know you, you telling us about yourself, getting your history, and then talking a little bit about the testing that we need to do. I am undergoing IUI. My first few baseline ultrasounds, letrozole trigger, had 14 follicles, and in recent months, the baseline had showed 29, almost 2 times. Is it normal to double the follicles, or is there a risk that they are cysts? I'm assuming you're talking about like the baseline ultrasound yes, you did say baseline ultrasound with like the little follicles. So it is normal to see some variability from month to month. It's not the exact same number every month. So every month you have like a pool of follicles that gets recruited. And that's kind of what we have to work with. And it's different month to month. It's fairly similar, but it's not exactly the same. Now, a lot of the baseline is very subjective. And so you have a sonographer or a provider that's scanning you, and they may miss some or they may double count some. So it can be a little bit discrepant. I would say 14 or even 29, that's reflective of a good ovarian reserve. That's a good number of follicles to start with. Is there a risk that they are cysts? I mean, cysts are usually could be a little bit larger. So usually they would mention it separately in the ultrasound. They could be a little bit larger than just a little teeny follicle, but so they can look very similar. Cysts and follicles can look very similar on ultrasound. So it's really sometimes can be hard to tell. If an egg retrieval yields 10 eggs, can 5 be exposed to sperm only and 5 be kept to the side for ICSI if natural is not successful? Do you mean just not for, I'm assuming you mean not fertilizing 5 eggs and just keeping them to see if natural fertilization or if the regular insemination worked? Technically, yes, but I would say you can technically keep the eggs in culture for the following day. I would say a lot of it is insurance dependent, especially in this state, if we can do this. But technically, you can choose to only fertilize half the eggs and then leave the other ones for ICSI if needed in the future. So technically, yes. This was really helpful. Thank you. You did my embryo transfer earlier this year. Yay, which was successful. Oh, wonderful. So congratulations. I'm so glad that was a success. What questions should I ask my doctor before starting IVF for unexplained infertility? So the questions things to be aware of if you're getting ready to start IVF, I would say definitely talk about expectations. So the questions to ask, one would be what they perceive your chance of success being, and that will be depending on your age and if there's anything else going on in your history. Good questions to ask would be how to expect to feel, risks, benefits, like how you'll feel during the IVF cycle. Different people have different responses to it depending on what your ovarian reserve is. You can, feel really bloated and tired. Other people feel totally fine. So that's something else. And kind of what restrictions or none during the IVF cycle. For example, we always recommend, low impact activity, nothing too crazy. Abstinence is really important so that you don't have a concomitant pregnancy during the IVF cycle. And then just kind of asking the questions about what comes after we get the eggs retrieved, like the attrition rate, which a lot of people sometimes are surprised with because they always think like, oh, we got 20 eggs, that means 20 embryos. And that in fact is not true. And so just asking about that, just so that you have your expectations set as to if I get X number of eggs, how many embryos do I expect, can really help once you get those results back afterwards. Besides a doctor's recommendation, can a patient decide to have a twin pregnancy? So the decisions are all yours. So as long as we counsel you as to what we think is best, it is totally up to you. Now, if you do treatments like ovulation induction, there is a slight increased chance of a twin pregnancy because you are potentially ovulating more than one egg that month. And so you do have a slight increased chance of a twin pregnancy. Now, if it is IVF, the recommendation to transfer more than one embryo is, in fact, a recommendation. Now, do you choose to follow that or not? And do you want to transfer more than one embryo? You can, and we can. A lot of it will depend on insurance. So if insurance is not an issue, it's a conversation to have with your doctor and see if you're both comfortable proceeding with that. But a lot of the times, like I said, in Massachusetts, at least, it is insurance driven. So if insurance isn't going to cover it, then we usually end up not doing it. But again, it is totally up to you. How painful or uncomfortable is the egg retrieval and recovery? So the egg retrieval itself is painless because you are asleep. So you are getting propofol, which is medication through your IV. You are asleep, so you don't feel the actual egg retrieval. Now, afterwards, you do have some discomfort. I would say it varies. I've heard my patients say anywhere between like a 2 out of 10 to up to like a 7 or 8 out of 10, depending on your threshold. It depends again on how many eggs you got, how large your ovaries were during that time, but there is some discomfort from the bloating that happens after the IVF cycle, from the actual egg retrieval, and you do have a teeny bit of just bleeding that happens after the egg retrieval because there's so many blood vessels around your ovaries. And a little bit of bleeding in your pelvis, though is not dangerous, it can irritate things. And so it can be a little bit uncomfortable. Usually resolves within 2 to 3 days of the whole thing. And it does get better every time. So I would say usually very manageable with Tylenol, with ibuprofen. Rarely will I see people in a lot of pain that's not managed with these kinds of medications. Is there any support groups offered in the New Hampshire area for infertility? Yes, so we have our office in New Hampshire that you can definitely reach out to if you have infertility, want to seek care there, and they do have social work, counseling that can help, and they can also put you in contact with any support groups that they have to help you through this journey. I've been with Boston IVF since April and I've had 2 unsuccessful donor IUIs. I'm 36. Is there anything that I can do to help myself get pregnant? I'm just discouraged and would like some inspiration. I just want to tell you, do not be discouraged after 2 IUIs. I don't know what the specific circumstances are in your case, but if you have otherwise normal testing and you are 36, it is up to a 10% chance of success per month if you truly have infertility. Now, if you're just doing it donor IUI, don't have specific infertility, we have good data to suggest that most people are successful within the first 3 to 4 cycles, excuse me. And so I wouldn't give up after 2 cycles unless there's a reason to, something going on in your history. But usually I would say 3 to 4 cycles, up to 3 to 4 cycles, the highest chance of success. And once we've gotten to that 3 to 4 cycles, it's not the end of the road. We always have other options with, for example, IVF, even if, it does have higher chances of success. And so you are still young at 36 with a good chance of success. So I wouldn't lose hope after 2 IUI cycles, because any couple that's trying to conceive, if you're doing this, if you're a same-sex couple or you're doing this on your own or for donor IUI for other reasons, I would still say try for 3 to 4 cycles, because we don't base it just on the first 2. Okay. My TSH levels were high at baseline. I'm on levothyroxine now. Can you talk about the importance of TSH while trying to conceive? Yes, that's an excellent question. We always check the TSH during our fertility workup because abnormal TSH levels can impact your fertility. And so it depends what your diagnosis is. If you have an elevated TSH because you have hypothyroidism, like full hypothyroidism, meaning you have abnormal thyroid hormones, as well as the TSH, which is the hormone your brain produces to signal your thyroid to produce the appropriate thyroid hormones, then that would be something to tweak with your prescribing provider, like your endocrinologist. They can sometimes have different parameters than we use, but for us, at least from a fertility perspective, if you have what we call subclinical hypothyroidism, meaning your thyroid hormones are fine, but your TSH is a little bit elevated, we have different parameters. Usually we'd say under 2.5, that is perfect. Over 4, that is high. When you're in this gray zone of 2.5 to 4, we usually base it on the presence of antibodies to the thyroid, meaning do you have antibodies to your thyroid that's putting you at higher risk of a thyroid disorder at some point? Then if you do, we usually use a lower threshold, meaning the 2.5. But if you don't, then we're okay with all the way up to 4 before we start treating. And if you're already on levothyroxine, like you mentioned, we usually will tweak it until we get to that threshold of 2.5. Is acupuncture something that can help improve fertility? So there is a lot of talk on, stress and fertility. Now, the bottom line is, if you have a stressful lifestyle, if you're under a lot of stress, it is not the reason for your infertility. But they are intertwined a lot, meaning people that struggle with infertility are usually under a lot of pressure and stress because they really want it to work. And you do see a lot of people that have really stressful lifestyles also struggle with infertility, but not usually just related to it. Acupuncture, especially around the time of like an embryo transfer, or if you're trying to conceive, really does help kind of keep the stress level down, the anxiety down. It can help just overall help this. Does it specifically increase your, statistically, your chances of success? I mean, that's a little varied when it comes to the data around that. But I would say a A lot of people really like the acupuncture, especially around the time of the embryo transfer. So if that's something that you like and that's offered to you, you should definitely do it. Love Boston IVF. You got pregnant after one round of IUI. That's excellent. I did have a slew of patients recently got pregnant after their first IUI, which is always so amazing that, it was a short treatment round just to get you pregnant. And so that is wonderful. I wish you a really healthy pregnancy. Right. I think that was our last question for today. So thank you all for joining me. It was a pleasure to answer all of your